In this video, you're going to learn how to use your D'Oxyva Transdermal device. It's really easy, so this will be a short video. When you first get your device out of the box, you'll have some pamphlets in it. You'll want to take the time to read those because they contain very important information. So when you pull your device out of the box, you'll see this. Probably might be a different color, but this is basically what you'll see. Got your on and off switch, which is right here. This is off right now, and to just turn it on, you'll just push it down like that, and to turn it off, you'll press it back up. Okay? Now, the first thing you'll want to do is open this case up, and to do that, you'll press right here. Okay? So just press down and slide this up. And what you want to do is you want to take the water container out. Okay? And you'll see that it has ridges that correspond to the ridges in your device as well. When you put the water container back in, you'll want to line those up so it's a smooth fit. Okay. Now what you want to do is you want to fill your container up with water. Okay, there's a line, a fill line right there. And here's a better picture so you can see it more clear. Now what you want to do is you'll take the red, where the red line is, the red arrow, that's your fill line. You want to make sure the water is underneath the fill line. If you put it fill it up to the fill line or any higher, then you'll probably get some leakage. So you want to make sure that you want to fill your water up to right to where my level is. I'll put this picture down below so you can continually see it without having to watch the video over and over again. Okay, so now what you want to do now that it's filled is you want to place it back in your device. And so just line up the grooves and make sure it fits in there real nice, and then close it up until it snaps. Now you'll want to make sure that it's closed all the way, and so just you'll pull on it, give it a little tug, and if it doesn't open up, then it's good to go. Alright, the next step is you'll want to remove your CO2 container cup. Okay, this is your CO2 container cup, and you'll hold it. It'll hold the CO2 container. So just drop that in there like that. Make sure the tip is up. Alright, and then you'll take it and screw it down. Now you'll fill it. Don't screw it all the way down yet until you're absolutely ready to use your device, because once you actually puncture the CO2 cartridge, then it will start releasing the gas. Even in the off position, it will leak a little bit, not much, but it does leak. That's the way all CO2 cartridges work. Okay, so don't screw it all the way down until you're ready. Now when you are ready, what you want to do, I'm going to hold it over the microphone so you can hear it. You'll hear a little pop. Okay, when you hear that little pop, then you know that your CO2 cartridge has been punctured. And then what you want to do is either take your thumb and place it in here, or even a finger, just depends. Mine are too small for the opening. You can see the opening is will take a fairly large thumb. And so what you want to do is, if your thumbs are too small or your fingers are too small, then just use the palm of your hand, because the pores in your fingers and the palm of your hands and the bottom of your feet there are more pores in those areas of your body than anywhere else. So your bottom of your feet, your palms, and your fingers have the most pores. So in either way, what you want to do is make sure that you get a good closed seal, whether it's through your thumb or palm of your hand or finger or the bottom of your feet. It's a lot easier to do it somewhere on your hand than it is to do it on the bottom of your feet, of course. Alright, so when you're ready, what you want to do is make sure that it's angled where the cup is up. Okay, you want this portion up, where you're going to insert your thumb or put your palm. Now to know about what angle you want to keep it at, you can bring down the kickstand and lay it on a table, and that'll give you an approximate um, angle that you can keep it at. Now you don't have to keep it on the table, but that gives you an idea of the angle you want to keep. You don't want to keep it flat, and you don't want to have this part down. Okay, you want to keep it up, but you don't really want it straight up either. Okay, so once you're ready, put your hand over there and make sure you hit the on button, and when you do, you'll hear it. And you should hear a hissing sound and a bubbling sound. Okay, and this will go on for about 5 minutes. Sometimes a little longer. It does depend on the CO2 cartridge and how well it's been punctured, and basically how it's been loaded. And when the 5 minutes are up, what will happen is the hissing will stop first, but it will continue to bubble. You don't want to stop doing this until the bubbling has stopped. Okay, so what I'm going to do right now, this is going to take about five minutes, sometimes up to 11 minutes. That's the longest it's ever taken mine, is about 11 minutes. So I'm going to turn this video off right now and wait till we're finished, or just about finished, and then come on back. Okay. Okay. Now it's been about 7 minutes and it's still bubbling. Let me see if you can see that. You can see it within there. It's still bubbling a little bit. But what you want to do is, as it's ending its cycle, then what you give it a little shake or a little pop on the bottom. And what this does, it helps the gas in the that's still in the CO2 cartridge move up to the top and come out. Okay. And then once it quits bubbling, because I can't hear the gas anymore, all I see now is just the bubbling. Now you'll want to do this every single day for the first 30 days, and keep it consistent, like on your palm all the time or on your finger all the time. You want to be consistent for the first 30 days, and what that does, it helps your body get used to the new oxygen that you're putting into your bloodstream. Okay. Then once you've completed your 30 days, then you can switch around. For instance, if you're wanting to get rid of some wrinkles on your face or something, you can actually apply it directly to your cheek or anywhere that there's healthy skin. If you want to get rid of some stretch marks, you place it on stretch marks. Make sure you always have it angled up, but place it on the stretch marks or in the area as long as the skin is healthy, and start doing it in different places. Varicose veins, same way. If you have varicose veins on your legs, then start doing it on your legs after the 30 days, and that'll help your varicose veins as well. Okay, well, the bubbles have stopped completely, so you want to make sure that you turn your device off, okay, before you unscrew the CO2 cup, because if there is a little more gas in there and you unscrew it, it'll pretty much blow out. So make sure you turn it off. Okay, and then this is really, really cold now, because when CO2 disperses, it gets really, really cold. So what you want to do is open up your cup, and if it's stuck in it like that, just give it a little tip and it'll fall out. And you can see that the cartridge is actually frosty now. It's very cold. So what I do is I just leave it in there until it warms up a bit. Then the next step you want to do is go ahead and take your water container out. So press this lever again right there and just slide it open and then pull this out. Now you can see that it didn't use that much water. That's why You don't have to do this every day. You don't have to fill her up every day. You can leave the water in there, and it'll take about a week for it to get down to where you'll want to refill it again. And remember, you want to fill it underneath the line. Okay? And that's it. That will do it. You'll might have some condensation left in here and in here, so just take a paper towel or something and clean it out real good, or dry it out real well. And same thing with that. And then it's ready to go, ready for the next day. Okay, and if you ever have any questions about your device, always feel free to call us. The numbers and the contact information is all down below. Thank you for watching. If you like this, if you got any information out, please like it and subscribe to our channel. Please leave a comment down at the bottom. We appreciate you. Thanks. Bye-bye.